off because I'm sharing the screen.
Okay, fine.
Monica, the meeting is live. Monica, you're on mute.
Good evening, everyone. I'm Dr. Monica from Shield Healthcare. So I coordinately invite you for today's webinar. And the topic of the session is probiotics in IBS. And our speaker, Dr. Sadasiva Pade, who is MD Pediatrician and PGPM from Boston, MBBS from Madras Medical College, APT Masterclass PN, Consultant Pediatrician and Neonatology from Bhubaneswar. I welcome you to this session, sir. And before starting the session, I would like to give a brief introduction regarding our Shield Connect page, which is a knowledge sharing platform which includes various blogs, webinars, and all the newsletters, awareness related to gynecology and pediatrics. And we can find the upcoming webinars and ongoing webinars. So we can find here, and whatever the information, medical information is there, we can find in the blogs here. So this is regarding our page, sir. So I would like to hand over this session to Dr. Sadasiva Padi, sir.
Thank you. Thank you. So we'll be starting our session. So I'm sharing my screen. Is it visible?
Yes, sir, it is visible.
The screen is visible. Okay, thank you. So good evening, everybody. So we'll be starting this educational platform this about probiotics in irritable bowel syndrome. So before that, we will be focusing on what are the topics we will be discussing: the introduction, symptoms, causes, and types, diagnostic criteria, treatment and management, probiotics, and improving issues by probiotics, and at last summary. Okay. So the introduction. This is a group of symptoms, and this occur together related to. Excuse me, just one technical problem. Okay, so with introduction, this is a group of symptoms that occurs together, including repeated pain in the abdomen and changes in the bowel movement, which may cause diarrhea, constipation, or both. With irritable bowel syndrome, a child can have these symptoms without any visible signs of damage or disease in digestive tract. So, although the symptoms are clearly present, when the bowel is examined visually and under the microscope, there is no evidence of tissue damage. So, will be without any damage, and it's comprising of group of symptoms. So what are the symptoms? Bloating, cramping, chronic or intermittent diarrhea, chronic or intermittent constipation, urgency with defecation, incomplete sensation of defecation, and passage of mucus in stool. So with uh, what are the causes? Mainly it is idiopathic, and one theory that a person with a irritable bowel syndrome may have a colon that is more sensitive and more reactive than the normal individual. This causes the bowel to respond strongly to stimuli that would not affect others. The nerves that control the digestive tract may also be more sensitive to digestion. Children with irritable bowel syndrome may be more aware of gas and motion and rumbles of the intestine. They are more aware of and more bothered by this discomfort. So children's age such, they are having so much of awareness. So they will be showing that they are more bothered. And children may experience symptoms due to problems with how food moves through their digestive system. They are having a enthusiasm of knowing all these things, and there will be hypersensitivity of the inside of their bowel of to stretching and motion, and stress, overgrowth of bacteria in their bowel. It is important to know to the child that their abdominal pain is real, not imaginary. Most of the times, we also ignore that it is just the baby is complaining out of fear or out of some stress given in the school or like that. So, but this is a real pain. So, who is affected by IBS? IBS occurs both children and adults. Almost 14% of high school students and 6% of middle school students complain of irritable bowel syndrome like symptoms. Girls and boys are equally affected. There is no known gene that causes IBS, but the disorder does seem to occur more often in families where either a child or parent has disorder. Prevalence of IBS in children. There is somewhat limited data regarding the prevalence of IBS in children. It is estimated to be anywhere between 2.8% to 22.6% worldwide. The figures take into account factors including age, race, ethnicity, and country of origin. So here, a very important factor is age. Many studies has reported high prevalence of IBS in children aged between 8 to 12 years of old. Other countries report even higher prevalence in children, like 13.25% in China and 16% Nigeria, 22.6% in Turkey. Why irritable bowel syndrome? A child with IBS often does not feel well. A child with diarrhea may have little warning of the need to go to bathroom. Therefore, the child may be embarrassed and try to avoid going to school or socializing with schoolmates. This may cause depression and anxiety. Most children with IBS continue to grow and develop normally. However, some children may eat less to avoid the pain that can accompany digestion. This can lead to weight loss. So what are the symptoms in kids? So there are two types of symptoms, the discomfort or pain. It's depending upon the age. As already I have told, age is a significant factor. So recurrent abdominal pain, the pain becomes chronic when it has been present for more than 3 months. An altered bowel pattern with digestion and diarrhea and constipation, all of which suggest intestinal motility problems. Nausea, dizziness, and loss of appetite will also be there. So how it is variable? Because it is age dependent. So in infantile age group, mostly in the age group of less than 4 months, it happens as infantile colic in babies, and younger than 2 years, it represents as reflux, gastroesophageal reflux or heartburn. And chronic non-specific diarrhea occurs younger than 4 years of age. Constipation can occur at any age, and IBS in adolescent and adults, it will be a variable symptoms like diarrhea, constipation, or mixed. The symptoms of IBS are not unique to the condition. Altered bowel patterns and abdominal pain can be symptom of many other conditions. Always consult your child's healthcare provider for the diagnosis. Don't jump into diarrhea. Diarrhea means antidiarrheal medication. Constipation means any laxatives. This should not be practiced. Is it inflammatory bowel disease or irritable bowel syndrome? So we have to know what is a clear-cut difference between that. So IBS symptoms are bloating, bloating, gas, mucus in stool, nausea, headache, and in inflammatory bowel disease, that is IBD, which will have symptoms of bloody stool, blocked bowels, vomiting, weight loss, delayed growth, loss of appetite, fatigue, fever, joint pain, painful skin rashes, and eye problems. So this is a huge there is definite damage to the bowel is there, but in irritable bowel syndrome there is no definite damage. It is just group of symptoms, but some symptoms will confuse because it occurs both in IBS and IBD, like abdominal pain, cramping, and diarrhea. So what is going on in irritable bowel syndrome? There is a crosstalk between brain and gut, that is enteric nervous system. So connection between the brain and gut is known as brain-gut axis. The BGA pathway includes GI system, including the central nervous system, endocrine, neural, and immune pathways. Patients with IBS have disturbances in BGA, including CNS, peptides, and hormones. The clinical presentation of IBS patients with pain, psychological comorbidities, and altered bowel motility may be explained through changes in brain-gut axis. So what happens? So any gut pathogens or gut microorganisms, they have a direct connection between the enteric nervous system and the gut. So IBS, which is a bidirectional altered communication between the gut and the brain. So what happens in this picture? We can see. We use this pen. So here you can see the brain and gut. So they are working together synchronously. So there will be altered processing of the stimuli from the gut, hypervigilance and impaired HP axis, and there will be comorbid anxiety, depression, or stress. So which in turn gives rise to a visceral hyperactivity, motor dysfunction, altered barrier function, low-grade inflammation, infection, altered microbiota composition and metabolism, neuroactive and neuromodulatory metabolites. So gastrointestinal dysmotility, which can give rise to two variants like constipation and diarrhea. So IBS-C and IBS-D. So in IBS-C, food moves very slowly through the bowel. This causes stool that is hard to pass. And in IBS-D, that is diarrheal mode, the food moves too quickly through the bowel and causes watery stool. So we'll go through the predominant stool form pattern. So there is a Bristol stool chart is there, type 1 to type 7. So in Bristol stool form scale is a validated descriptor of the stool form and consistency. In type 1, there is severe constipation, separate hard lumps will be there. And type 2, mild constipation, lumpy and sausage-like. And type 3 will be normal, a sausage shape with cracks on the surface. And the normal one can also be like a smooth and soft sausage or snake. And lacking fibers, that is type 5, soft blobs with clear cut edges will be there. And in type 6 is mild diarrhea, type 7 is severe diarrhea, which will be of liquid consistency with no solid pieces. So what are the types? Now types already I have told it is of 3 types, that is IBS-C, IBS-D, and another one is mixed IBS. So IBS-C is constipation predominant, tends to alternate constipation with normal stools. Symptoms of abdominal cramping or aching are commonly triggered by eating. So diarrhea predominant, that is IBS-D, tends to experience diarrhea first thing in the morning and after eating. This needs to go to the toilet is typically urgent and cannot be delayed. And mixed one, it can have alternately constipation and diarrhea. So here we can see the pattern of stool that is lumpy or watery, and in diarrhea it will be mostly of watery, and a non-specified and mixed pattern we can have more than 25%, and in unspecified it is less than 25%. So what is the diagnostic criteria? The child's healthcare provider will perform thorough medical history and physical examination before diagnosing it as IBS. So lab test will also be done to check any infection or inflammation. So these are the tests we are doing, blood tests to evaluate whether your child is anemic, have infection, or have illness caused by inflammation or irritation. Urine analysis and culture to assess for urinary tract infection. Stool samples to check the bacteria and parasites that may cause diarrhea. Lactose breath hydrogen test to determine if your child is intolerant to lactose. Abdominal X-ray, ultrasound, and endoscopy, colonoscopy. Endoscopy to examine inside the upper part of the GI tract, and tissue samples from inside the GI tract can also be examined for testing. And colonoscopy to the lower large intestine and the distal part of the small bowel. The diagnostic criteria is Rome 4 criteria, which defines IBS functional bowel disorder with recurrent abdominal pain is associated with defecation or change in bowel habits. Disordered bowel habits are typically present, that is constipation, diarrhea, or mixed pattern, are symptoms of abdominal bloating or distension. Symptom onset should occur at least 6 months prior to diagnosis, and symptoms should be present during last 3 months. The patient meeting Rome 4 criteria are recurrent abdominal pains for more than 1 day per week on average in a previous 3 months, associated with at least 2 of the following, that is pain related to defecation, change in frequency of the stool, and change in form or appearance of the stool. Change in frequency means if the child is having previously constipation, now having normal stools also will be considered, and the baby is having normal, now having liquid stools will also be considered for this. So what are the supportive symptoms in Rome's diagnostic criteria? In constipation predominant, 1 or more of abdominal pain less than 3 times a week, hard or lumpy stools, straining during bowel movement, and diarrhea predominant, 1 or more than 3 bowel movements per day, loose, mushy, or watery stools, urgency. In general, feeling of incomplete evacuation, passing mucus per rectum, and abdominal fullness, bloating, and swelling. What is the treatment? Treatment of IBS will be determined based on child's age. Already I have told age is a very important parameter. So overall health also very important, and medical history. Extent of the problem, child's tolerance to specific medications, procedures, and therapies. Expectations for the course of the condition, opinion, and preferences also to be considered. And what are the main objectives to restore the normal daily function, all function? Management begins with a positive diagnosis of IBS. This will give children reassurance that they don't have a life-threatening condition. Treatment may include dietary changes, medications, probiotics, and stress management. So the treatment plan will be according to the pattern, that is constipation predominant or diarrhea predominant. So establish doctor-patient relationship also important. Acknowledging the disease, educating the patient, and reassuring. Lifestyle modification like dietary fibers, including increasing the increase in soluble fibers and increase in physical activity, avoid stress and sleep deprivation. In constipation predominant, we need to give osmotic laxatives and antispasmodics. And with medications, other medications like linaclotide, lubiprostone, and selective serotonin reuptake inhibitors, and psychotherapy. And in diarrhea predominant, we need to give loperamide along with antispasmodics if needed. And the medications we use rifaximin, cholestyramine, ondansetron, and eluxadol. And for psychotherapy, we are using tricyclic antidepressants. For mixed pattern, we need to give antispasmodics, medication like rifaximin, and tricyclic antidepressant psychotherapy. Now, for kids, what is the management? Parents can help children, but encouraging them to focus something funny or pleasant and distracting during painful episode. If a child is lactose intolerant, it is recommended to restrict lactose or supplement the enzyme that digests the sugar, like lactose or lactate. Lactose sugar can be a trigger for symptoms for IBS, like lactose intolerance. The use of high fiber in children with IBS is somewhat controversial since it can promote gas and bloating, which is the most common symptoms of IBS. However, high fiber diet is recommended for adults and may help children with IBS related constipation. So, depending upon the severity of child's symptoms, medication may be needed. In rare cases, specialists may be consulted for the pain control. For pain management, we need specialist prescription, and biofeedback and acupuncture may be used to relieve painful symptoms of IBS. So, what is the lifestyle or diet modification? A diet low in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, that is FODMAPs, which are short chain carbohydrates and sugar alcohols that are poorly absorbed by the body. For example, FODMAPs, that is wheat, dairy, sugar, avoid tea, coffee, avoid gluten. Lifestyle modifications like increasing physical activity, over-the-counter agents like fibers and laxatives. So here there is a diet chart. So we should be considering more of grains and also more of vegetables, little less of dairy products, and too little of sweets. So low FODMAP gentle diet food list, which includes grains like wheat and some wheat products, ray-based products, vegetables like onion, garlic, leek, cauliflower, mushrooms, and so these are of high FODMAPs. So we'll be think of avoiding this to go to the low FODMAP swaps like wheat products, rice, quinoa, corn, and vegetables. What we are using: pepper, potato, lettuce, carrot, eggplants, celery, green tips of spring onion, garlic, and fruits like we will be using orange, banana, grapes, strawberry. Dairy products like lactose-free milk, lactose-free yogurt, and meat and alternatives having low FODMAPs are plain cooked meats, means not of fried items, poultry, then seafoods, egg, farm, tofu, all those things. So with management, US FDA approves prescription medication options include linaclotide, lubiprostone, and plenacatide for both IBS-C and CIC. So tegaserod and tenapanor are approved for treatment of IBS-C constipation predominant, while lucalopride are approved for use in CIC. So what is the role of probiotics? Our main topic of concern now. Probiotics is of very useful in IBS. Non-FDA approved therapies like antispasmodics, hyoscine, dicyclovir, atropine, SSRIs, selective serotonin reuptake inhibitor, fluoxetine. So these are not approved by FDA. So FDA approves these prescription medications, this linaclotide, and for CIC, lucalopride, and probiotics. So now we are coming to the topic proper, that is role of probiotics in IBS. So intestinal microbiota. The intestinal is an important for maintenance of host health, providing energy, nutrients, and protection against invading microorganisms. And colonic microbiota is relatively stable throughout adult life. However, age-related changes in gastrointestinal tract, as well as changes in the diet and host immune system reactivity, inevitably affects population composition. So what are the probiotics and prebiotics? Both probiotics and prebiotics are important for human health. However, they are different, having different roles. Probiotics are live bacteria found in certain foods and supplements. They can provide numerous health benefits. Prebiotics, the substance, come from the type of carbs, mainly fiber, that humans can't digest. The beneficial bacteria in your gut eat these fibers. The gut bacteria, collectively referred to as gut flora or gut microbiota, perform many important functions in the body, like eating balanced amount of food. Both probiotic and prebiotic can help ensure that you can have a right balance of this bacteria to keep your microbiota healthy. So how these are helping? Probiotics are dietary supplements that contain live bacteria that are known to be beneficial to the digestive system because of their ability to balance the intestinal flora. Probiotics are available in the form of capsules or pills, even liquids also. Several studies have proven the health benefit of probiotics, strengthening the immune system and promoting better digestive process. Not all strains of bacteria in probiotics can be beneficial, but increased number of facultative anaerobes in conjunction with a decreased in beneficial organisms such as anaerobic lactobacilli, bifidobacteria, among which the other anaerobes has been reported. These changes, along with general reduction in the species diversity of most bacteria groups, the changes in the diet and digestive physiology, such as intestinal transit time, may result in increased putrefaction of the colon and greater susceptibility to the disease. So resident bacteria within the human gut are considered as represent crucial line of defense against the colonization by potentially pathogenic microorganisms. So dietary supplements containing prebiotics or probiotic or a combination of these or both these are called symbiotics, and they are very helpful against the colonization of pathogenic microorganisms. So microbiota is combination of beneficial and pathogenic microorganisms. But the beneficial microorganisms keep the pathogenic organisms under control. So what is gut eubiosis, and the opposite of that is gut dysbiosis, which causes IBS. So gut eubiosis is the good bacteria keeping in control the harmful bacteria. So helps in normal function of the intestine. While dysbiosis, there will be a disbalance. There is an imbalance. So in the there will be more of pathogenic microorganisms than the helpful organisms. So the probiotics are not having a good control over the pathogenic organisms. So that disturbs the normal function. So what is a healthy gut and inflamed gut? So here you can see healthy gut is functioning normally, while in inflamed gut is if somebody is blocking, somebody is hampering in the normal function. Nutrient absorption will be affected. So what is dysbiosis, which is a immune reaction? Gut has a mucus gel layer full of good bacteria. Tight junction permeability and permission is granted only through those those good substances, and entry of bad substances triggers the immune system. So we can, with this figure, we'll understand what is eubiosis and dysbiosis. So in eubiosis, there is a normal intestine which allows only nutrients and good substances. So you can see the intestinal contents are there. But how to recognize this good substance or bad substance? So here the epithelial cells, and there is a tight junction is there, lamina propria, and mucus layer is there, that gives a portal of entry, so that only good substances are getting entry and there will be homeostasis will be maintained. So while the leaky gut, it will allow all the bad things. What are the bad things? The bad things can be present in the food particles, or like it can be controlled by the like toxins, chemicals, pesticides, even hormones also. So these are affecting the gut health. So there will be disturbance in the biosis, that is dysbiosis. So there will be immunomodulation and release of pro-inflammatory mediators. Chronic low-grade inflammation will be there. So what happens in IBS, which leads to damage to intestinal lining. This results in imbalance of the intestinal flora or bacteria. Then a bad bacteria wins over the good one. The symptoms of IBS occurs. So the imbalance in the intestinal flora can lead to change in optimal pH. So whenever there is in IBS is there, so the bad things will be more. But the problem, but the good thing in IBS is there will be no damage will be there. So here the symptoms will be of more. So without damage, how these things are happening, because it creates a hormonal or a acidic environment. The change in optimal pH will be disturbed. So with research, we have found out the study published in so many articles. The multi-strain or multi-species of probiotics are beneficial to IBS because that will give a control over the pathogenic microorganisms. The multi-strain probiotics have been found to provide general relief of IBS symptoms such as abdominal pain, discomfort, and bloating. Additionally, multi-strain probiotics can have a significant effect in the altering of intestinal environment. So why need in IBS? IBS, why you need probiotics? IBS symptoms has been linked to the change in gut flora, and people with IBS have lower lactobacillus and bifidobacterium in the gut, and the higher level of harmful, that is pathogenic microorganisms like Streptococcus, E. coli, and Clostridium. Changes in the gut flora may increase inflammation, increase sensitivity to gas in the intestine, reduce immune function, and change digestive motility. So IBS symptoms occurring post GI function or other antibiotic use like good lactobacillus destroyed due to antibiotics. So what is the role of probiotics? The probiotics have been proposed to improve symptoms by inhibiting the growth of disease-causing bacteria, that is pathogenic bacteria, enhancing immune system's barrier function, helping fight inflammation, slowing down the bowel movements, reducing gas production by balancing the gut flora, reducing gut's sensitivity to gas buildup, and overall IBS symptoms improve. So how it is happening? We are giving a probiotic. So effective, what is the effective probiotic cleaning products contain more beneficial bacteria? What is that effective one? So more of probiotic bacteria, which gives rise to a faster, longer lasting cleaning. So initial dose we give only to bacteria, that is 2 microorganism probiotics. Quickly it becomes billions of beneficial bacteria that helps to control the pathogenic ones. So these are so many studies in which we have found the probiotics are very helpful in irritable bowel syndrome. So from various countries and various journals, we have got these studies. The microbiome and irritable bowel syndrome, a review of pathophysiology, current research, and future therapy, immunotherapy, all those things. So what are the best probiotics for IBS? Lactobacillus plantarum relieves bloating and abdominal pain. Lactobacillus rhamnosus decreases the intensity and frequency of abdominal pain in the IBS. Lactobacillus cereus and Lactobacillus reuteri, which decreases abdominal pain in IBS. And Lactobacillus acidophilus relieves bloating, abdominal pain, and motility. So different probiotics give a different benefits. So we can give a combination of this, or with the particular some symptoms. For example, having abdominal pain, like infantile colic, we are particularly giving Lactobacillus reuteri. So what is the best probiotics? So this is not like anything, all other probiotics are not good. So this bifidobacterium, this has been found to have the most promising result in the treatment of IBS. And bifidobacterium bifidum is a clinical trial we have done. with this strain, 47% of people with IBS has reported improved symptoms. And we have got so many of clinical evidences of lactobacillus and bifidobacterium, which are having a maximum benefits in IBS. So here in one study, we have given lactobacillus acidophilus, then Saccharomyces cerevisiae, and lactobacillus rhamnosus GG, and bifidobacterium, and so many studies we have given in capsule form, twice daily we have given. And there are in especially they have taken non-specified and diarrhea predominant IBS cases, and the significant improvement was there within uh, 4 weeks, is minimum of 4 weeks to up to 12 weeks of time period. So here also there are so many studies are there by Ludini, Neslam, 2016, 2017, 15. They have taken bifidobacterium, lactobacillus plantarum, rhamnosus, and bifidobacterium longum, Bifidobacterium infantis, brevis. They have taken so many things, and they have found study with this 6 weeks to 12 weeks of study duration. They have found a significant improvement is there. Okay. Here also there is lactobacillus acidophilus and lactobacillus casei and lactobacillus rhamnosus, which improves the quality of life in IBS and decrease the symptoms, which is a randomized and placebo controlled study, also gives a good confidence interval. And it has been found a 4-week treatment with lactobacillus plantarum provides effective symptom of relief, particularly abdominal pain and bloating in IBS patients fulfilling the Rome 3 criteria. So coming to the last slide, that is a summary, take-home message. So irritable bowel syndrome is a gastrointestinal disorder characterized by chronic abdominal pain and altered bowel habits in absence of an identified cause. So it is a idiopathic cause having a group of symptoms. The causes and pathophysiology of IBS are multifactorial. We have gone through all those things, and probiotics has very significant role in IBS. Especially, we are having one of the best probiotic, bifidobacterium. Thank you.
Thank you so much, sir, for such sharing time being and a good information regarding the IBS. All new things which we have discussed. I hope delegates would be very much will be helpful for them, and even I have even learned few new things. So, sir, actually we have 2 questions from our delegates.
Yes.
Shall I repeat it?
Yes. Yes.
One question is, how long should we prescribe probiotics for IBS? They're asking duration, sir.
See, durations, if you are starting a probiotic, you will having relief of symptoms like 1 week to 2 weeks, you can have relief of symptoms. But minimum of 4 weeks to up to 3 months, that is 12 weeks, is the prescribed duration of treatment. We have seen a significant improvement of, we have given a standard studies that gives 4 weeks, minimum of 4 weeks of study. So minimum 1 month treatment should be given.
Okay, sir. And the another question is, how to take probiotics with food or an empty stomach?
Probiotics, such, these are all microorganisms. So there is no chances of damage to the probiotics. There are studies are there. If you give a coated probiotic, it generally bypasses the gastric pH, that is very acidic pH. Okay, so generally we should be avoiding a very empty stomach. It can be given before food or after food, it then does not matter much. But if you are giving a very empty stomach, like early morning, it should not be done like that. If we are giving after food, it will be having a uh, support from the GI tract by not destroying the product as such. If you are giving a non-coated form, if you are giving a coated probiotics, there are some preparations which give coated probiotics. They will bypass the GI tract without any damage to the spores. So we need to have for having a beneficial effect, we need to have a minimum of 5 to 10 billion spores per day to have our important effect to control this IBS. So if you are giving a underdose and there is chances of damage, so it's better to avoid, taking in the empty stomach.
Okay, sir. So we need to take this probiotics after food. We should avoid an empty stomach.
Yes, yes.
Yes, sir. That's it, sir. We have only 2 questions from our delegates. I guess their doubt has been cleared. So I would like to thank you for this time, sir, for giving your valuable time for this session. And with your permission, can we end the session, sir?
Yeah. Thank you.
Thank you so much, sir. Thank you.